Children usually develop their teeth between 6 months and 12 months of life. During this time, you might notice that many infants use their hands to bite on, and it's part because they're eating solid foods, but also because sort of putting their hands in their mouth and sort of biting on them is a self-soothing behavior at 6 months or so. Between that time and 12 months of age is when babies will have their first teeth come in, or a process we call teething. Teething can usually be a rough time for some babies and their parents. It can cause discomfort, they can be cranky, and the main result of it is teeth. During this time is key to help keep your infant comfortable. There's a number of products out there in the market, be it teething gels, teething bracelets and necklaces. With anything you give your child, please make sure you're checking the ingredient labels to see if there's anything harmful that could be in it. Also, with teething necklaces and bracelets, there's potential for it to be a choking hazard, because if a bead on that bracelet or necklace comes off, we want to make sure it's not something that your child can swallow or have it get trapped in their airway. Also, if it's a teething necklace, the concern is, what if this necklace can become a suffocation hazard for your child? So at any time, if you use any products that you've purchased, make sure it's appropriate for your child by checking labels and also checking with your child's pediatrician. Usually when teeth come in, the first two come in on the lower level. Those are called your central lower incisors, and then they pop in on the top. So babies look like a little bunny rabbit in the beginning. And then the next set come on the bottom, on the outside of those first two, and on the outside of the top. So then your child ends up with a set of 4 teeth above and below. Now, sometimes some infants will have their first tooth at 6 months. Other times I've seen them with their first tooth on their first birthday. That is just the range of time. It all depends on your child, and no need to be comparing with the child down the street. Teeth are going to come in when they decide it's time to come in. So just give them time for that to happen. Most parents I've found have seen that the best results for a teething ring are the ones that are cold, because there's already water inside of them, and you can put them in your freezer or refrigerator, because most babies, they just want something to help soothe the soreness of their gums when their teeth have been coming in. Having a frozen hard thing to bite on really provides relief, more than most topical products that are just there to numb the gums or do other things to help them get through teething. Around 2 years of age, is after the incisors have come in, is when the molars come in. For some children, that is a whole nother can of worms. It is as if teething started all over again, whereas others transition to it pretty easily. Again, same thing. At this age, you may not really have teething rings for them, but if you need to use a medicine like acetaminophen or ibuprofen to help their discomfort, that can be used. Before baby's teeth come in, this would be a good time to get them used to having someone checking their mouth, and this is why it's good to take a towel to wipe down their gums every evening before they go to bed. This will get them used to having someone checking their mouth, but also it makes sure they have good gum health, so that when their teeth come in, there's a nice, healthy area for the teeth to grow. Infants should start having their teeth brushed at least in the first phase when you start seeing a tooth present. You don't need to use a lot of toothpaste, maybe about a little smaller than the size of a pea, because most infants are not going to really try to spit out the toothpaste after you brush your teeth and you rinse. They're going to want to swallow it or eat it. So using a small amount of toothpaste is okay. Dentists would like to see children at least by their first birthday for their first appointment, or within 1 to 2 months of their first tooth erupting. So when you first see that first tooth, or if it's closer to their first birthday, you should be calling your child's dentist's office. Starting good habits for dental health early are key to keep good habits in the future. So as your child's growing and they're able to do more on their own, it's good to have them get used to brushing their teeth on their own. And if they miss some spots, have them do it themselves first, and then you come in after to get spots they may have missed. That's all I have for today. Thank you again for taking time to listen to this talk about teething. As always, take care of yourself and others and stay healthy. As we've said before, we're going to help cut down the spread of COVID-19. If you're in public places and you can't be more than 6 feet away from people, please wear a face mask, cover your nose and mouth, and help contain the spread of COVID-19. Thank you, and I'll see you again next week.